May I start with another topic in preventive medicine about the difference between case control study and cohort study. So many students are so exhausted, so tired by trying to find what they mean by case control study and what they mean by cohort study and what is the difference between case control and cohort study. Let me show you with two diagrams. One is for case control, another for cohort. Yes, dear students, you listen carefully. This is the photo of case control study. You can see two groups at the last side of this photo. You can see cases as well as control. Cases is a group of people having the disease, and the control is very similar group, but they do not have the disease. Cases having the disease, control do not have the disease. Now, you are following not following, actually you are taking their history. You are taking the history of cases as well as you are taking to the history of the controls. I mean, you are peeping into past. Then what you find, and you have to find that whether the cases is exposed to your risk factor. Suppose you are estimating the lung cancer, then lung cancer, you are finding a group of lung cancer patient and you are inquiring to them that how many of you are exposed to tobacco smoke and how many of you are not exposed to tobacco smoke. And just like that, you are also taking the history of controls and you understand that how many of them is exposed to risk factor. I mean, how many of them is exposed to tobacco smokers, and another thing, how many of them are not at all exposed to the tobacco smoke. These are all the way of reaching conclusion in the case control study. What I am telling, you see, this is a retrospective study. Means we are going backward. We have a case, we have a control, and we are taking the history, whether they are exposed, whether they are not exposed to a particular risk factor. Just like that, we are taking the control, we are taking the history, and we are finding that how many of them are exposed and how many of them are non-exposed. After getting this data, we make a table. We have several methods to find whether the risk factor is associated with the disease or not. Okay. So what I want to tell you is that case control study is going backward. Case is there, control is there, exposed, non-exposed. Number of exposed, non-exposed, both in case and control. Now, what about cohort? I told you that case control is a backward-looking study. We are taking the history. But cohort is a forward-looking study. I will teach you. You just listen. See, cohort study is more time-consuming. Cohort study is more costly. Actually, you have a cohort, exposure cohort. A group of people is exposed to a risk factor. Suppose smokers group. As well as you have a non-exposure group cohort. I mean, those who are exposed belongs to one cohort, another group not exposed to this risk factor. We are telling about smoking and lung cancer. So, those who are smokers, we are looking for how many of them have lung cancer. We are looking forward. You would find a group of smokers and you are studying for 10 years about that smokers. From where you will get the data? From the hospital. Okay. Then you identify that out of the smokers, how many of them have lung cancer. It's forward looking. We are leaving the patient for 10 years as smokers. Now what about these non-smokers? What about non-smokers also you find that whether how many of them have lung cancer. Now we find using several calculations and making tables, we reach an assumption. Let me conclude, just wait. There are two types of study. Case control study, in which case is present, control is present, backward looking, exposed, non-exposed, exposed, non-exposed. What about cohort study? Cohort, exposure cohort, non-exposure cohort. Exposure cohort contain how many of them disease, how many of them do not have disease. The non-exposure cohort contain how many of them disease, how many of them do not have any disease. This is forward looking. This is prospective study. This is incidental study. The rest of the case control is, actually case control is very cheap and easy to find a conclusion, but it is less accurate. But the cohort study is more accurate, more expensive, but more time consuming also. You understood this thing. Thank you for watching. You will get one-to-one teaching, online teaching if you WhatsApp me directly. Thank you for watching. Bye.